Hello, everyone. I just want to say hello to you all and make a couple comments before we head into the weekend. It's certainly been an interesting week, unlike any week that I've seen in a long time. It's hard not to refresh your phone or your computer to see what's going on with the United States. Certainly not over, but before we head into the weekend, I just wanted to say a couple things. One of which is that I'm deeply honored and humbled to be taken over the role as chair for the Department of OBGYN. I want you all to know that this is not a good department. It's a great department. And my goal, with the help of you all, is to make this a truly fantastic place to work and for us to really make a difference in women's health care, not only at UAB and in the state, but nationally and internationally. I want to spend a couple moments thanking two individuals, Doctors Tita and Jenkins, for their leadership and friendship. But I want to spend time thanking particularly Dr. Jenkins in his role as serving as interim chair for this department. I don't think that this department quite knows the level and depth of his commitment and dedication to this department and his tireless work in terms of making this department a better place. We owe him an enormous amount of our personal gratitude, and I would ask all of you that the next time you see Dr. Jenkins that you verbally thank him for all that he has done. He certainly deserves it, and I want to make sure this group hears that from me particularly. In the upcoming weeks and months, there are several things that I want to execute, not the least of which is meeting with all the faculty, trainees, staff, nursing leadership, hospital leadership, about where the department is today and to fully execute a strategic plan or roadmap for this department for the next 5 years. In that roadmap will include strategies related to recruitment, development of novel programs, understanding what our relationship is with the community, our space needs, the future for research and education. It'll be a very comprehensive strategic plan and one which many of you will provide input on. And we'll share that with you in the upcoming months. I also want to share with you what my overall vision is for this department. And there's several things I think that apply to everyone who's listening to this video. One of which is to really raise the bar of healthcare for all women and individuals in the state of Alabama. That is our responsibility, and we're obligated to provide that to all women within the state, not just the Birmingham metro area and not just at UAB. Number two is to make this the leading public health institution for women's health care in the U.S. Three is for this to be the epicenter for training the next generation of women's healthcare leaders. And my hope is that our trainees will go out and serve as leaders, whether it be in their community or whether it be at an academic institution or at a research institution. I just want us to be able to train the next set of leaders to make a true difference. Number four, to be inspired by the work that we do and to make UAB and our department a safe place to work, a place where we all enjoy coming to work, we work collaboratively, and we feel like we're contributing in a very meaningful way, hopefully on a daily basis. And lastly, I think perhaps the most important thing is to make sure that we address the issues related to diversity, equity, and inclusion. I very much want us to have a strategy around this, for us to have this discussion, for us to be comfortable to talk about this as a group, but to understand how important this is, not just to ourselves and how we interrelate with one another, but also how important it is for subsequent patient care. It's the backbone for what we do. Anyway, I hope you all have a wonderful weekend. Again, I am deeply honored and humbled, more than you'll ever know. My door is always open. I look forward to leading this department. We have great faculty, staff, and leadership. And again, like I said earlier, this is not a good department. This is a great department, and our job and responsibility is to make it even better. Have a great weekend. If there's anything you need, just let me know. Otherwise, I'll see you all next week. Take care.